Patellofemoral pain syndrome is a common condition characterized by pain in the front of the knee, specifically around the patella where it connects to the femur. This type of knee pain is often associated with activities that put stress on the patellofemoral joint, including running, squatting, and walking up or down stairs. The patellofemoral pain syndrome is colloquially known as runner's knee due to its prevalence among athletes, although it can also affect individuals who engage in everyday activities or remain seated for prolonged periods, earning it the alternative name moviegoer's knee. The pain experienced in PFPS typically arises from irritation or overuse of the patellofemoral joint, which can result from various factors including muscle imbalances, abnormal patellar alignment, or excessive stress on the joint tissues. Individuals may report symptoms such as a dull ache in the front of the knee, a feeling of locking or catching, and a grinding or crackling noise when moving the knee. Several risk factors have been identified that contribute to the development of patellofemoral pain syndrome. These include repetitive stress on the knee, overtraining in sports, weak hip or thigh muscles, and poor biomechanics during physical activities. Additionally, anatomical variations such as genu valgum or genu varum and the angle of inclination of the femur can influence the alignment and movement of the patella, exacerbating the condition. One of the primary causes of patellofemoral pain syndrome is overuse, which occurs when the knee joint is subjected to repetitive stress from activities such as running, jumping, or squatting. These activities can lead to irritation of the bone or soft tissues around the patella, resulting in pain. Athletes often experience this condition due to the high demands placed on their knees during competitive sports. Weakness in the hip or thigh muscles can further exacerbate patellofemoral pain syndrome. Weakness in these muscle groups may lead to poor biomechanics during movement, which can increase the risk of developing patellofemoral pain syndrome. Misalignment of the patella due to muscle imbalances, tight lateral structures, or weak medial stabilizers, particularly vastus medialis obliques, is another reason for patellofemoral pain syndrome. Increased quadriceps angle or Q angle due to femoral anteversion, genu valgum, or external tibial torsion also leads to patellofemoral pain syndrome. Additionally, conditions such as genu valgum and genu varum can alter the angle of inclination of the knee joint, affecting its alignment and contributing to the development of patellofemoral pain syndrome. Tight iliotibial band, hamstrings, or calf muscles could be another reason for patellofemoral pain syndrome. Foot mechanics, including conditions such as rear foot eversion and pes pronates, can exacerbate PFPS by leading to increased internal rotation of the tibia, which affects knee alignment and tracking of the patella. Proper footwear and orthotic interventions may be beneficial for individuals with foot abnormalities. By recognizing and addressing these risk factors, individuals can take proactive measures to reduce the likelihood of developing patellofemoral pain syndrome and improve overall knee health. Physiotherapy protocols for patellofemoral pain syndrome focus on a multifaceted approach that incorporates manual therapy, exercise therapy, and load management strategies. These protocols are designed to alleviate pain, improve functionality, and address the underlying biomechanical issues contributing to the condition. Physiotherapists must instruct patients to avoid aggravating activities like running, jumping, and prolonged sitting, and use low-impact exercises like swimming, cycling with proper seat height. Pain management includes applying ice or heat therapy and other electrotherapy modalities, and non-steroidal anti-inflammatory drugs to reduce inflammation. Research indicates that manual physiotherapy techniques, including mobilizations and proprioceptive neuromuscular facilitation stretching, are effective in treating patellofemoral pain syndrome. A systematic review found that combining manual therapy with strengthening exercises targeting the entire lower limb kinetic chain can lead to greater and longer-lasting improvements. Exercise therapy is a critical component of physiotherapy protocols for patellofemoral pain syndrome. Tailored exercise programs focusing on strengthening the quadriceps, hamstrings, and hip muscles are essential for improving knee alignment and reducing pain. Quadriceps strengthening exercises like straight leg raises, mini squats, step-ups focus on vastus medialis, obliques activation. Hip strengthening exercises like clamshells, side-lying leg lifts, and hip abductor strengthening focus on gluteus medius and maximus exercises to control hip internal rotation. Release tight structures like the iliotibial band, hamstrings, and calves using foam rolling or manual therapy. Additionally, proprioceptive and balance training exercises like single leg stands, wobble board exercises, or balance pads are helpful. Gait retraining to address overpronation or abnormal gait patterns, and the use of orthotics if necessary to correct foot alignment must be considered. Taping or bracing includes patellar taping like McConnell taping to improve patellar alignment. Knee braces with patellar support are also used as an effective part of treatment. Gradual reintroduction to sport-specific or functional activities is one of the responsibilities of physiotherapists, which focuses on proper technique and alignment during dynamic movements like running and jumping. The patient must continue strengthening and stretching exercises to maintain muscle balance.